Hi there, and thank you so much for watching. Here you can see we are getting ready to treat a patient with PDO smooth threads, and I'm just marking her treatment areas accordingly so that I have a plan once I go to start my procedure. She was numbed with a topical anesthesia for about 10 minutes prior to this point, and then she's been cleaned and prepped and ready to go. We are treating the downturned corners of her mouth, the submental area, and then the prominent necklace lines that you can see across her neck. She also does have a scar on her right lower neck that we've been treating for quite a while, and so we're going to treat that area as well, try and break up that scar tissue to minimize the appearance of the scar. So we are using V-Soft Lift twisted threads. It is a 29 gauge by 40 millimeter thread. The twisted threads do stimulate the most collagen out of any other smooth thread. And the reason for that is if you can get a really close look at that thread as it's being inserted, the thread is actually wrapped around the needle, and therefore once you insert the thread, it does create a little bit more tissue injury upon entry, which increases that fibroblast activity and in turn will create more collagen. So we save these for our patients that were really looking for the most collagen that we can produce. This patient in particular has been receiving smooth threads for several years. She's not a candidate for filler and likes the more natural approach of PDO smooth threads. And so we decided to bump her up at this appointment to a twisted thread just to really maximize her results. The twisted threads are a little bit more uncomfortable for the patient to have placed because that thread, you have to apply a little bit more force to get the thread into the proper plane. And so it does tend to be a little bit more uncomfortable. It's a little bit more difficult for the injector as well to place these threads. But with proper training, you can definitely become proficient in this skill. The AAFE does teach PDO smooth threads courses both virtually and live and in person. And it's a great opportunity for you to learn different treatment areas, different treatment approaches. There's no right or wrong treatment plan for smooth threads, but you do want to come up with a treatment that's comprehensive and is going to maximize collagen production in your desired area. We stimulate collagen about 1.5 millimeters from where that thread is placed, and therefore your threads have to be placed pretty close together in order to get nice equal collagen formation in that area. So you can see here we already have the threads in for the downturned corners of the mouth, and now we are addressing the submental area. Here she is looking for a little bit of skin tightening. In the marionette lines, she is looking to stimulate collagen. She's had some volume loss there and would like to sort of try and fill in that area. And then after this, we're going to move down to the necklace lines in the neck. The necklace lines can be a little bit trickier to treat because the neck is curved. And so it is really important that you're in the proper plane as you're coming across the curvature of the neck. There's obviously a lot less tissue in the neck, at least on this particular patient. And so you have to be in the proper plane to avoid potential for complications and in order to get the best results possible. So you can see once we sort of move across the anterior neck, it's important that you try and curve that thread so that you're able to maintain the appropriate plane. This patient will be treated with a series of 3 treatments, 1 month apart. So after today's treatment, we will see her back in another month and then another month following that. At that point, she can either decide to continue treatment or take a little bit of a break. The max collagen time frame is 3 to 6 months with smooth threads. And so she could certainly opt to take a break from 3 to 6 months and then return for an evaluation. And at that point, we can decide, if we're happy with the results, then perhaps we treat her annually. Or if she feels like she still needs to make some progress, then we might decide to start another round of 3 treatments. But in general, anything less than 1 treatment is just not going to give you much in terms of results. So a lot of providers will sell their treatments in a package to ensure that the patient comes back, and that forces you to have the conversation with the patient that this really does require some patience on your part. The results are going to be gradual, but over time, they will really, really see the results. Be sure that you always get really good before starting photos. So that way you can show them their progress, because these results are relatively gradual. Sometimes they don't even appreciate the progress that they've made without seeing a side-by-side photo of where they actually started. So it can be a pretty cool experience to share that with the patient. A lot of times they say they didn't even recognize that they had any of these changes. And so it's quite rewarding. In any event, we're just about done with this patient's treatment. I did leave all the threads in just so you could sort of see the different directions of the threads. In a couple of her areas, I did decide to go back and put like a couple extra threads just to, again, maximize that collagen stimulation. And now we're going to remove the threads. You can see that we're twisting those hubs 360 degrees prior to removal. This will engage the tissue in the thread so that when you pull the hub out, the thread stays behind. And so it's a pretty easy process for removal. You can see here I've already twisted those, and then we're going to remove, and we'll see her back in a month. And from there, we'll complete her series of 3 and then sort of reassess at that point. Smooth threads are such a fun treatment, honestly. They're quite easy once you have the appropriate training, and the patients love them. We do a lot of smooth threads here at the AAFE Training Center. And so I would strongly encourage you to look into a course, either a virtual course that we offer, or consider coming to a half-day in-person course where you can really dive in and get a lot of different treatments under your belt to bring back to your practice to offer to your patients. Thank you so much for watching.